Okay, I'd like to welcome Celia Bolton, who is a pelvic health physio, to talk to us about what happens after a pregnancy loss, especially around the pelvic floor and around the pelvis in general. Thanks so much for joining us.
It's a pleasure, Peter. Thanks for having me.
So you've been working in this area for a long time, haven't you?
Yes, since 1998.
That shows our age, doesn't it?
It does. I've met a lot of people, I can tell you that.
Well, what I wanted to talk to you about was we know that there's not much research directly about a pregnancy loss and how it affects your pelvic health. But we do know that hormones and stress can really affect your pelvic health. And we just wanted to have a bit of a discussion so that women who have had a pregnancy loss can have a bit more practical information around this.
Our pelvic floor is impacted by stress and hormones, definitely. And it is a little unpredictable as to how that can go. But the majority of the time we see that people that experience significant stress and difficulties with stress and in this case loss, there's a fight-flight in your body. And that fight-flight in your body is a system that gets you ready to run or fight. And we tend to, when we're ready to do those things, to contract and protect ourselves. And so it's pretty normal that after a pregnancy loss and what you've been through, a lot of different things can happen, but definitely there can be some tension in the body, and for good reason. Otherwise, though, if someone has a tendency to weakness and if there's emotional and physical pain through this process, you can equally lose muscle tone as well. Sometimes muscles will turn off. So there's no hard or fast rule, but I'm hoping that if whatever you're feeling, that is real and your body is responding and changing. And so if you feel things like a dragging or heavy feeling in the pelvic area, maybe lower back aching after sitting for long periods, achiness or tightness or sharp pains in your pelvis, or maybe having some trouble with urge or loss of urge of bladder and bowel and some constipation, all of those things should settle with getting back into normal routines as much as possible. But if they're continuing, it's worth being checked out. So you could go to a GP, and pelvic health physiotherapists are quite comfortable to talk about all of those things and would support you to improve.
The other thing I thought that we could discuss is also when your stress hormones are high, especially cortisol, it can affect your gut health. And some women can experience constipation where others go the opposite way and have loose bowel actions.
Absolutely. And so you might have a tendency to go one way or the other. That might be something that you could predict a bit more, but definitely cortisol and that mind-gut axis through the vagus nerve will actually be changing based on having big changes in your body over a short period of time.
Let's talk about painful sex. Women shouldn't be experiencing painful sex, but it may occur. So what would you recommend if this happens?
It's not something to ignore, that's the main thing, and definitely not something to push through. And, you know, your body's going to take some time to change. The hormones are changing quite a lot. If someone's going to have low estrogen or just big changes in their hormonal profile, they can get a bit dry in the vagina. So sometimes it can be as simple as using lubricant, but that's assuming that you've got a libido and you are interested in getting sexually active again. So if you're feeling like you don't want to, that's something to totally honour. And if you're wanting to and it's painful, try some lubricant, but don't push through, and definitely go and get checked out. And the sorts of things that might happen at the GP is they might talk to you about estrogen, but you can see a pelvic health physio. And that's what Peter was saying before, that sometimes our pelvic floor can be a bit tight because we're a bit worried about how this is going to go. And when your pelvic floor is a bit tight in that situation, it really can cause some discomfort. So a lot of these things are pretty easily addressed, and earlier is a bit better than leaving it for months and months and months. Yeah, so that's one thing you can do.
I think one of the key things that you pointed out is not to push through, because I think if you feel pain one time and then you try again, you're going to have the fear of feeling pain, and so you're going to put yourself more at risk of having this cascade happen to you.
Yeah, it's such a natural thing that if you're thinking, oh, this might hurt, then we naturally tense up in anticipation of pain. The sorts of things that a women's health or pelvic health physiotherapist might help you with is teaching you how to relax your pelvic floor, use some relaxation strategies, talk a bit about communication, and very, very gently returning to sexual activity. I've talked about lubricant. Sometimes we use what's called dilators. They're called trainers as well. And that's about having the opportunity to baby steps get used to that sensation of something in your vagina. But that's only if everything else has been checked out. And it seems to be that it's mostly a protective pain or a protective muscle tension, and those graded exposure, we call it sometimes, but just getting used to the feeling can be quite helpful.
And I think what you said with this, if you're not ready as well, that's fine.
Yes, there's so many different responses in that situation, but you've got to be ready and feel safe.
I think breathing's a big thing that we could give them as a tip.
Oh, yes, absolutely. Grounding strategies and breathing strategies, depending on the skill set of the person and what seems to work best for them, because everyone's different. But the breathing strategies can be so lovely and they're so simple, and that's just breathing into your belly. You can put something on your tummy when you're lying down and just watch it rise and fall in that upper belly area as you breathe. And it doesn't have to be big. You don't have to count it. It doesn't have to be fast or slow. It's just finding a natural, restful rhythm. And having something to focus on seems to have this double whammy of settling the nervous system down. Other sorts of things we tend to do is the grounding strategies, which most people have heard of by now, but it's actually coming to your senses. Sometimes moving into your body can be a bit too much too soon. What I mean by is bringing your attention into your body can be a bit too much too soon. So we ask people to imagine a square and breathe around a square, breathing in as you trace your eyes across an imaginary square out in the distance, breathing as you go across and then breathing out, breathing in as you go across and coming up, breathing out. So that's one thing. Another grounding strategy, which is my favourite, which is just noticing where you are in space. And you could try it right now, noticing your feet and where they're supported, noting where your bottom is supported. If you're sitting, noticing where the rest of your body is supported by something, and feel your connection with it, that it is there, it's solid, and you can rest into it. And that was something that Elizabeth Stanley did research on. It's called contact points. It's so simple. And if sleep is a bit of a problem, it's a great thing to use both those breathing strategies and maybe contact points to notice where you're supported by the bed or moving into a breathing strategy. But breathing strategies are fantastic for helping to relax pelvic floor, helping to take a rest in between a pelvic floor contraction, and also for any sort of pain sort of strategy to calm the nervous system as you're approaching something that might have made you tense in the past.
So one of the things that we have had questions about is when should they start pelvic floor work up again if they were doing it? What is your recommendation?
Well, again, Peter, we don't have research on these things, and so we've got to really default back to a person's individual experience. But the pelvic floor should be ready pretty soon, in that if you can contract it and it feels pretty comfortable, then you're on your way. As soon as you've done one, you've started your pelvic floor exercises. The sorts of things you can do in a test condition is just start one or two at a time and start pretty gently. Most people know what pelvic floor exercises are, but the pelvic floor is a bowl at the base of your pelvis. The urine pipe, the urethra, the vagina and the anus are all in a row there, and the pelvic floor will lift and close that area when you contract. And as I said before, it's really equally important to be able to relax it fully. And if you're starting pelvic floor exercises, doing a contraction with a good restful period afterwards is a great way to relax the pelvic floor. Some people are a little scared if they're being told their pelvic floor is tight that they shouldn't contract it. There is some recent research, not in this population, but to actually, when there's sexual pain, that doing contract and relax is a very good thing to help relax the pelvic floor.
I think one of the other things that people don't realise, and I think what you said before is a really good tool to use, is they don't actually realise they're carrying tension because they are stressed and they're just holding themselves really tight. So just bringing yourself back into your own body at your own time to start checking those things, I think is really helpful, because you may not realise that you're clenching your bottom muscles when you're standing because you're stretched, or that you're clenching in general.
Absolutely. And it does take one moment. I teach meditation as well, Peter. I don't know if you know that, but from that tradition, we always start with the face, the jaw, and the shoulders. To do that will actually usually help the whole body. It's also quite a common thing for people to have a tight pelvic floor. They also have a tight jaw, so really relaxing around the face. But you can do a quick scan and just go, a little bit of a sigh and a let go. And don't be worried if you do get tense again in a few minutes. It's something that will change over time.
Yeah, well, thank you so much for helping us out with this. And it's great to just have some practical information around what they can expect, or, someone may not feel any of this.
Yes, absolutely. And we just have to really, as health professionals, be led by people with what they're experiencing and obviously get checked out. But then the next thing is okay, what are the practical things that are easy to do, that are achievable, that definitely are going to set you in the right direction, and that you're really, believed, and that anything you do is actually a discussion and approach it with curiosity, because the research isn't there. So you will become the expert in the room.
Yeah, especially when it's your own body.
Absolutely.
Okay, thank you so much for joining us.
Such a pleasure, Peter. Good on you. Keep this up.